They get further treatment, they get further evaluation, they go to an emergency room of a hospital, they go to some facility where there's some close supervision and observation. Well, there are research studies that are looking at intervention programs that can be done in schools and in primary care offices. A few questions about their family history and things that are going on at home. We need to go back to the point that impaired people are getting access to firearms, and we need to target that more. A person's admitted to keep themselves safe. It's much more of a conversation rather than a doctor saying, we're going to strap you to a gurney and we're going to inject you with this. When your judgment is that impaired, you may not be thinking of pinpointing one individual. For all we know, he might have been thinking the whole world is out to get him.
A new special.
It can cause long-lasting, damaging effects. An unconventional way of making friends. They need a trained mental health professional to help them with this. Sometimes they require medication, sometimes they require close observation, sometimes they require a different modified structure. It's never too early to call for help or even ask questions about a loved one or someone that you know that may be going through things of this nature. Being a child star and growing up with the expectation that, hey, you are on top of the ladder and you have to continue that through your whole adult life can be pretty stressful. What we do know that is there are specific screening methods that are effective of identifying high-risk youth who are capable of committing acts of violence such as these, and those are things that should be done prior to even purchasing a gun. Custody battles and custody disputes can be very difficult for children. It's a surreal life being surrounded by people all the time taking your pictures. If you think of a work environment and you're always surrounded by a group of people, you get to know those people. Somebody can be a very high-functioning individual and get sick really quickly. Is it an epidemic? Researchers say there's a few factors that contribute to the rising rates. One of the things people need to remember is they need to inform whichever doctor that they see that what are all the medications they are on. Number one, the diagnostic criteria has broadened, so kids who weren't diagnosed previously are being diagnosed now. Number two, because there's greater knowledge and efficiency in the diagnosis, kids are being diagnosed more quickly. Everybody's body is different, and a doctor needs to know exactly what you've been taking, how long you've been taking it for, and that includes if you're going to more than one doctor. This is a family that's under a huge amount of scrutiny, and it's really hard to speculate based on generalizations of what's going on, how the children are exactly being affected. I'm Dr. Anandhi Narasimhan, and this has been For Your Health.